4 years, Hassan Lutaya endured teasing from his schoolmates because of his leg. The 9-year-old says he was called all sorts of names.
When I ngenda kusoma ngabana baga ngabanvuma kalema ngabagamba namwe kijabatuukako.
His suffering began in 2006 after an injection that was supposed to cure him of malaria left him disabled instead.
He was injected, he was treated, but after some time he started crying that my foot is paining too much. And after like 6 hours, he couldn't walk again.
Since then, Lutaya's parents have taken him everywhere, from Mulago Hospital and to both professional and traditional physiotherapists, in vain. It was only in May this year that they brought him here at the Comprehensive Rehabilitation Services in Uganda, KOSU, that there was some change. Lutaya's parents are not alone. At KOSU, there are several children with similar tales of post-injection disability.
After giving him the injection, they told us to go for the drugs. I told my son to move, but when he tried to walk, he just fell down.
Every year, doctors at KOSU see about 100 children suffering from injection-induced disability, accounting for 9% of the total number of patients here. Post-injection paralysis is fairly common in Uganda because many health workers and sometimes parents favor injections over other modes of administering medicines. While giving injections is an easy medical procedure, if the person giving it isn't aware of the dangers, it can cause irreversible damage, especially to children.
Remember that our buttocks, there are specific areas where the injection have to be done to avoid dangers. If a child is malnourished, or when the child is just 6, 7, 8 months old, the layer itself is very thin.
Besides giving the injection on the wrong site, paralysis can occur if the drug is too toxic. Drugs like quinine, if not diluted properly, can lead to disability. Once the nerves on the buttocks or the thigh are affected, it may result in deformity of the foot, scarring of the buttock muscles, and stiff knees.
Well, these children have, first of all, difficulty in walking. They cannot run, they cannot play like the other children. For some, they cannot even sit properly. Some of them actually leave school because they are teased. In order for them to sit, they have to sit with their legs wide open. Even squatting, they have to squat with their legs wide open.
In less severe cases, abscesses and ulcers can form in the injection area within a few days. Treatment for post-injection paralysis is difficult and usually involves surgery. The level of recovery often depends on the severity of the deformity.
When the problem is affecting the thigh or the buttocks, we have to cut this scar with a difficult surgery and to allow the muscle to slide again. For the foot, it's a bit more difficult.
While the children can regain the use of their feet, legs and knees, they may never walk as well as before the paralysis. At KOSU, the surgery for children below 18 is done free. Parents only pay for the cost of medicine and other expenses. Doctors say intramuscular injections should generally be avoided and must be used only when the patients are unconscious or unable to swallow. Drugs are said to be effective whether they are given orally, through the rectum or by infusion. But in case injections are prescribed, parents and guardians should inquire if there are no alternatives. Anna Tkunda, NTV.